Hello, my name is Stephanie Bentley. Today I'm here to speak to you about health promotion, specifically annual checkups. People every day die from preventable or treatable disease processes. This atrocity takes place due to the fact that people refuse to have their annual checkup or they fail to report changes in their body functions. You should receive a checkup every year, even when you feel healthy. You should also make sure that your blood work is done and that your age-related checkups are also done. This speech is to persuade you to have your annual checkups as well as the recommended screenings for your age group. The first step in exploring the need for checkups is to impress upon you the vast amount of treatable or preventable disorders that a yearly screening can catch. According to the United States National Library of Medicine, it is imperative that we each have a yearly screening. This allows the healthcare provider to catch problems before they worsen. High blood pressure and cancer are two of the very dangerous yet silent killers. They both begin without any symptoms. Unfortunately, by the time you no longer feel well, these disease processes have already begun to deal damage to your body. These are some of the tests that you should make sure that your doctor is running at your yearly checkup. Of course, your complete physical examination. You should also be running your blood pressure, your pulse, your respiratory rate, your weight, your height, and your BMI. You should have your complete blood count drawn, which allows us to see how your immune system is functioning, your blood sugar, which allows us to see how your diet is and how your liver and pancreas are functioning, your BUN and creatine, which allow us to see how your kidneys are functioning, your uric acid, which allows us to see how you're excreting uric acid, because if it builds up, it turns to gouty arthritis. You should have your hemoglobin A1C done, which is another blood sugar test, but this test is unique in that it allows us to see your diet over a span of 3 months. You should have your AST and your ALT tests done. They allow us to see how your liver is functioning. You should have your total protein done. This allows us to see your overall health. And it also alerts us to malnutrition. You should have your albumin test done. Your albumin is a protein that is excreted by your liver, and its job is to keep your fluid inside of your vascular system instead of going into your interstitial spaces. You should have your urine analysis done. This alerts us to any protein or anything that's coming out of your kidneys which shouldn't be. You should have your TSH and your free T4 done. This allows us to assess the function of your thyroid, which controls your metabolism and your body temperature. And you should also have your potassium, your magnesium, your calcium, and your sodium tests done. These allow us to see how your muscles are functioning. Everyone should have their annual checkups, but you should specifically have your annual checkups if you have any of these. If you are over the age of 30 years, if you have a family history of heart disease, if you have a history of high blood cholesterol, if you smoke, if you drink, if you have a family history of diabetes, or you have diabetes yourself, if you're overweight, if you lead a sedentary lifestyle, if you have high blood pressure, or you have a stressful or high-tension job. You should also receive the specific checkups that are recommended for your age group. Some of the tests that are recommended for men are, of course, their physical exam every year. They should also have their TB test done every 5 years. They should have their blood test and urinalysis done every 3 years from the age of 20 to 39, every 2 years from the age of 40 to 49, and every year from 50 and older. You should have your EKG done every year. You should have your tetanus booster every 10 years, your rectal exam every year, your PSA every year from age 40 to older. You should have your hemoccult blood test done every year from 40 and up. You should have your colorectal health tested every 3 to 4 years from 50 and up. You should have your chest x-ray done every year from 40 and up. You should have your bone health discussed every year from 60 and up. You should do self-exams every year. You should do testosterone screenings every year from 40 and up. And you should monitor STDs every year. For women, in the age of 20, you need your pap smears and pelvic exams done. You also need to get your HPV immunization and your meningococcal immunization. In your 50s, you need to have your thyroid test done and your bone density screenings done. And in your 60s, you need to have your herpes zoster immunizations. And if you've already had chickenpox, the herpes zoster virus is laying dormant inside of you. One second. Now we're going to discuss your heart and your liver functions. Your heart, of course, is the only organ that pumps blood in your body. It delivers all of your oxygen and your nutrients to every cell. Your liver has a multitude of functions. These are just a few. It filters all of the body's blood through the portal vein. It controls your blood sugar and metabolizes vitamins A, D, E, and K, which are in charge of your eyes, your bones, your skin, and your clotting factors. It also manufactures clotting factors. It breaks down almost all of your medicines. It creates the bile that your stomach uses to digest food. And it provides the albumin that helps to prevent fluid leaks in your vascular system. We'll discuss your lungs and your kidneys. Your lungs, of course, provide your gas exchange, your oxygen, your carbon dioxide exchange. Your kidneys filter the unwanted elements out of your body. They also aid in your blood pressure, and they expel fluid from your body, and they're in charge of your metabolites, which helps to keep your acid balance of your blood in check. Through my demonstration, you have heard about the importance of annual as well as age-recommended checkups. You have also been made aware of some of the important functions that your organs perform. Now that we have explored the need for yearly healthcare exams, hopefully this has inspired you to make your well-care visits a priority. These are a few of the questions that I want you to ask yourself. Do you think that your health is a priority? If so, have you had your yearly checkup? If not, are you scheduled for your annual age-related screenings yet? Thank you. Do you have any questions?
Yes, about BMI. What is a BMI?
Your BMI is your it's your fat to muscle ratio for your body mass index. Anything else?
Well, with the blood pressure, you said that is it true that if your family has a history of high blood pressure, that is kind of like a hereditary thing? Or
yes,
is it just, you can safely assume that you got it, or you just should get checked up because of your age?
You do have a higher risk. It does not automatically mean that you are going to have high blood pressure, but you have a higher risk and you should definitely get it checked.